Hello, I'm Sandra Quinn, and I am professor and chair of the Department of Family Science at the University of Maryland School of Public Health, and I'm senior associate director of our Maryland Center for Health Equity. And I'd like to introduce Dr. Jackson.
Hi, everyone. My name is Dr. Devlin Jackson, and I am an assistant research professor in the Department of Behavioral and Community Health, as well as a faculty affiliate with the Maryland Center for Health Equity, as well as the Horowitz Center for Health Literacy here in the University of Maryland at the School of Public Health.
So we're excited to share some ideas with you that may help you communicate with your clients, with family, and with others about the COVID vaccine. So we are very excited that you signed up to be part of Shots for the Shop in the shop, and this critical push to get people vaccinated for COVID, not just before July 4th, that's a big push, but ongoing. We know, and we're going to talk about communication, we know people are maybe hesitant, they may have questions, and they may not be trusting based on their life experiences, based on history with healthcare systems or government. So we're going to share some ideas and some thoughts and acknowledge that that is, in fact, those are potential challenges that make sometimes talking about the vaccine more difficult. So I'm going to start with answering what are common concerns about the vaccine. Over these last 6 months or so, I've spent a lot of time listening to some of the voices of clients in our barber and beauty shops with which we work, and listening to some of our community health workers who also, run those shops, and, as well as others. And listening to what are common questions people have. So I want to walk through some of them just so you kind of have a toolbox, you can kind of pull on these, as you're talking to your clients. So one of the things that has really prompted lots of questions and concern is, how did the vaccine process and the timeline move quickly? And so I want to talk a little bit about that and how it did move more quickly than we typically think of, and they maintained safety at the same time. So on your screen, you see this preclinical phase when researchers back in last January, February, March of 2020 were really at this phase where they were looking at their microscopes, they were looking at cells, they were then testing preliminary vaccines with animals. And typically what happens then as we go into the next phase, the human trials, is that typically you'd have the preclinical phase in the laboratory. Then you'd have phase 1, which is a small trial. It's often only a couple dozen people. And it's to look at safety of a vaccine and the immune response it stimulates. Then you do that trial, you'd analyze your data, you plan phase 2. Then you do that trial, it's bigger, a couple hundred it might be, and you do that trial, which takes months, and then you analyze your data and you plan phase 3. Phase 3 are the big trials. Those are the trials that you've probably heard talked about in the media. And those are the trials of 30,000 to Pfizer was almost 44,000. And that's where we're really looking at not just safety, there's always a concern, but also looking at, does it really protect people from infection? Does it protect people from severe illness if they become infected? Does it protect them from hospitalization? And does it protect them from death? Typically, those things would be phased out over a much longer time, but you see how these are overlapping blocks. And that's exactly what happened. They were overlapping, and that enabled it to move much more quickly. The other thing that is just not done typically is that we wait for phase 3 trial to be over, would get the approval process, and then they start manufacturing. But this is a pandemic, right? And so people are getting infected and dying every day. So manufacturing started while phase 3 was still underway. Finally, and I'll talk more about this in a moment, the Food and Drug Administration, the Centers for Disease Control, the NIH were all ready to, do their review and approval process. And the distribution system was already being planned. So what could take years was done much more quickly because it's an emergency and because there was still great attention to safety, but we didn't wait, analyze, and then plan the next stage. And there were a couple of things that enabled us to do that. Number one is you, me, Dr. Jackson, we as the American taxpayer invested enormous amounts of money. So that's another thing. Nobody had to wait to see if they could get money to do the next phase of the trial. They used existing clinical trial networks. Some of you probably watched Dr. Andrzejczyk. She's from the University of Washington, and she is part of the COVID Prevention Network. So these are clinical trial researchers that are used to running clinical trials, so a lot of experience. The Food and Drug Administration, well, first let me back up and say that NIH had an independent review body called the Data Safety Monitoring Board. They literally met weekly and more than weekly from the beginning of these trials onward. They're still doing that. The Food and Drug Administration began working with Pfizer and Moderna and Johnson & Johnson early on so that the huge applications they have to put together in order to be considered for an emergency authorization or later the full approval, they were putting pieces in place and working on that all along from last spring. And finally, the Advisory Committee on Immunization Practices at CDC, they also have been working closely with FDA, with CDC. So everyone prioritized this. And the extent to which they could put some of the pieces in place before trials were over, they did it. And they were independent. So it was prioritized, and these committees were independent of the government agencies, independent of White House. And finally, one thing that was really important is the first 2 vaccines we saw being authorized were messenger RNA vaccines. They're somewhat faster to produce, which is a good thing. It was a good thing then, but it's a good thing now because they are going to be ones that will be able to adjust to variants more quickly. So one of the things that we've heard even in the first session we did with you is, were there Black people involved in the vaccine process? And I can't possibly give you, a sense of how many, but I want to highlight a couple people that were high level engagement, had high level engagement. And one is Dr. Corbett, who literally led the team on mRNA vaccine at the National Institute of Allergy and Infectious Disease. This amazing 34-year-old scientist. And so she was one. She was not the only one, but she has gotten a lot of attention, and this is her area of work, vaccines. Another question that I always hear is, were there people like me in the trial? Were there Black people in the trial? And so I just pulled a couple of these because these are presidents from historically Black colleges, and many of the all the medical schools at historically Black colleges and universities were advocates for participation in the trials. So let me just now give you a little bit of data too. So the Pfizer trial, which was almost 44,000 people, had just short of 10% African Americans, a little lower than they had hoped, but higher than often clinical trials are. Moderna had same thing, just below 9.7, I think, people who were Black or African American. Johnson & Johnson had 17%. So all of them were involved in working with the COVID prevention network and with community engagement and trying to increase participation in the trials. But the answer is yes, there were people. And the second thing that's really important about that is there were no differences in the effectiveness and the safety by race, by ethnicity, or by age. So that's really the big news, is everyone had the same safety profile, so that it was safe for everyone and it was highly effective. There's one other question, that is, were there people involved in the process of approving these? And I just shared Dr. Hildreth because he sits on the FDA committee called the Vaccine and Related Biologics Products Advisory Committee. I have to get it all out. It's a mouthful. He is one of several African Americans that sit on that committee and a well-established immunologist from Meharry Medical School. And I share this because this is one of the things he also talked about, was the distinction between the vaccine trials and the public health service study at Tuskegee. And I know that comes up as an issue and a concern, and I certainly understand and respect that that's real for people. They're concerned about that. But he does talk about how these vaccine trials were different. There was informed consent. There was an independent data safety and monitoring board that could stop these studies if they felt there was a breach of ethics or a concern about safety. And there, as he said, he was one of several. So I don't say that to minimize people's concerns, but I want to bring some of this to you because, you know, it's important that you know that there were people, and far more than I've highlighted here for sure. So let's talk for a moment about the messenger RNA vaccines. For many of us, myself included, they were a new phenomenon. I didn't know much about them. And so whenever something's new, we get a little more anxious about it often. And there have been a lot of sort of stories we've heard about, you know, well, what does this messenger RNA vaccine do? One that we hear a lot is it's going to alter our DNA. And that is actually not the case. It doesn't actually interact with our DNA. There's a concern, we often hear this about flu vaccine, that it will give you, if you take the vaccine, COVID-19. It can't. It has no dead or live virus in the vaccine. So you cannot get COVID-19 from the vaccine itself. You know, as I said, there's a lot of concern about it. It's brand new, it's experimental, it's never been tried. There's a lot of studies that have been going on, clinical trials that have been going on prior to this for using these vaccines with influenza, Zika, rabies, CMV virus, and others. There's some work being done on its use for cancer. So this is not a new platform, we call it, or a new mechanism, but it's new for many of us. One of the things that people have asked me is, can it affect women's fertility or my child's future reproductive health? And a couple things to know: there's no evidence that it affects women's fertility. In fact, there were women who were in the clinical trials who got pregnant and safely delivered. So there's no evidence of that. I understand how people would be concerned about that, but nothing that suggests that any of that is is in fact happening. Finally, that it contains fetal tissue or microchips or devices to track us and our movements, and those things are not accurate. we're always concerned, what are the side effects and what do we know about the safety of the vaccine? So a couple of things for you to know. Number one is the Pfizer, Moderna, Johnson Johnson could not even request a review and authorization until they had had at least 2 months post-vaccination data to examine for both safety and immune response. And they monitor in very complex ways, what is the safety response and what are, anticipated events uh, after somebody gets a vaccine and what are unanticipated events or side effects. So anticipated events are really much of what you see here is you're going to have, swelling on your arm, pain in your arm, it might be red. You might for 24, 36 hours feel tired or have a headache or muscle pain, even some low-grade fever. And those are things that were expected. And those are also things that give us the clue that our immune system is actually waking up and saying, hey, what is this? And so it is a sign that of our body's responding to the vaccine. That doesn't mean if you only had mild symptoms that you didn't respond. It's just everyone's slightly different. For most people, these are the things that happen. And these are monitored carefully. That's why you have to wait for 15 minutes. Are there more serious things that have happened? And we've seen some news reports, and they are investigated very thoroughly. That's why you saw a pause several months ago in using the Johnson & Johnson vaccine to stop and investigate. So safety, as I've said, what we consider side effects or adverse events are not by definition serious. They may be very mild and very short-lived. The clinical trials are ongoing even after we're using these vaccines because they're continuing to monitor safety and immune response. And they go on for 18 to 24 months. That will be something, that data is required in order to seek full approval for a full vaccine license by FDA. And so the US and people around the globe have you're using all the mechanisms, and there are multiple mechanisms to monitor safety, as well as tracking some new, CDC has a new app that people getting vaccinated can report their experiences. So it's really in many ways, there's sort of incredible attention on this because we know the vaccines we give to healthy people. And so we want to make sure they're safe. So I'm going to stop here and turn it over to my colleague, Dr. Jackson.
Thank you, Dr. Quinn. So some of the things that we have been hearing from our community champions, you all, our barbers, our stylists that have been working tirelessly to help in the efforts of the vaccination process is our question specifically about, what should you do and or say when sharing information with clients about the vaccine? And I think this is a very important and great question to ask because of all of the things that Dr. Quinn just went over when talking about the myths and the misconceptions and misunderstandings about the vaccine process, side effects, and so forth, and those who were or were not involved in the process. So one thing that I would say to first start off with is that it's important to share credible, reliable, and easy to understand information from public health officials. So what does that mean? Well, when we say credible, we want to ensure that this information has been vetted. It is information that we know is based on health evidence, public health evidence, evidence-based, meaning that this information is based on statistics or certain trials or certain studies, not something that is solely based on, one individual's opinion or one individual's personal experience. Although those things are important and are valuable, that cannot necessarily speak to the entire community, right? So it's important that we are sharing that type of information, credible. Then reliable, so and easy to understand. So reliable and easy to understand, meaning that this is information that it's not something that is going to create confusion. Information where the person is saying, well, wait a minute, but I heard, or you told me this, or they told me that, but information that's going to be consistent. And also information that also points out when there are certain things that are still being worked out or that we're still unsure of at the time. That's reliable information, right? Because the officials are letting us know, this is what we know right now, but we're still working to see what we'll know in the next coming weeks as it relates to that. And then the last part, easy to understand. Dr. Quinn has shared some terms and was excellent with explaining some terms, explaining all of these different terms that some individuals might say, well, what does that mean? Well, you want to make sure that you're providing information exactly the way Dr. Quinn provided a few moments ago, in these terms that may be unfamiliar to someone, right? That we're providing information that provides some explanation to what that information is. So they're not walking away even more confused or more uncertain than they were before. And then the last part of this bullet is public health official. That means that these are individuals who they have spent a lot of time and effort working to find out what are the right statistics to include in the information. What is the correct information about the vaccine? What are things that are dispelling myths and only reporting facts, not opinions, not ideas, but facts only. And so that brings us to the next point of providing relevant vaccine information. So we'd want to provide relevant vaccine information from public health officials like those who have been charged to take the lead in this space. So like the Centers for Disease Control, the National Institutes of Health, other organizations that have been partnering with these lead organizations, right? To where they are co-signing one another and saying, okay, we support the information that's being disseminated out into the community or shared with the community. Also, what another public health official with providing relevant information specifically as it relates to statistics at maybe the local or state level would be your local health departments, your statewide health departments. Those are excellent resources for where we can provide relevant vaccine information. It's also great because in addition to the national data or information that institutions like the CDC is providing, you also have at the state and local level, they can provide you specific information based on where you live, based on your zip code, based on your community. And that can provide even more understanding as to what is happening in my community and help those individuals better understand the information that's being communicated. Dr. Quinn, next slide. And then the other thing that you can do or say when sharing information is acknowledge the concerns and hesitancy that someone might have. One of the biggest things that we want everyone to remember that's a part of this initiative, myself included, is that our role is to just get the conversation going, get the conversation started. It's not to demonize anyone for their decisions as they're trying to still decide when and if they're going to take the vaccine, but to just get the conversation started and acknowledge if they come to you about, well, I have mistrust of not only the medical system, but of other systems that have not, that have failed me or have disappointed me, or my family, or generations before, or communities before me. And so we want to acknowledge that, we want to honor that, and we want to invite them to continue this conversation with us. So that brings to the next point. So acknowledging any concerns that they might have, including mistrust, but saying, I hear you. I'm familiar, I'm aware with these concerns. You might even want to share how those concerns connect to you, and tell them that, well, let's continue this conversation. Maybe on your next visit, let's talk some more about it. Maybe you'll bring back some more questions that you might have that I had not considered before, or maybe I have the information and I can share with you then. We want to just make sure that as we're continuing this conversation, we're creating a space where we're giving our clients all the information that they need so that they can make the best informed decision for themselves. And then that leads me to the last point, and that is, you want to refer clients to trusted, credible, and reliable public health officials when you are unsure how to respond. We never want to put you in a situation where you feel like you need to have all the answers. We don't have all the answers. We're still, realizing when, okay, you know what, let me get back to you and let me have a conversation with someone else who maybe is an expert in this area. And so if there's something that a client asks you or says to you that you are unsure about, speak to a public health official, but the key words that I put there, trusted, right? Because we want to continue to create trust, not only between you all and I, but also with the relationships that you've built with your clients. So we don't want to create a situation where we're connecting you with a public health official who isn't trusted, but they have reliable information, right? But it's not a trusted relationship that you feel will be the best space for your clients. So if you are unsure who that might be, you have us here, you have all of the team members with the Maryland Center for Health Equity, and those that are partnering with us in this very important initiative, that we can connect you with that public health official if there is a question that you are unsure to ask. So I hope that with these points, it helps you to feel more comfortable in the conversations that you've begun to have with your clients in these times of new findings and new situations for all of us with COVID-19. And then we hope that this is serving as a great guided tool for you as you are engaging with your clients. And if at any time you're unsure, we hope that you reach out to one of us, if not all of us, so that we can connect you with the right resources. And here are some of those resources that Dr. Gwen and I have included that are specific and can be relevant for the Black community. We understand that COVID is not only specific to the Black community, right? We know that there are other communities of color, other marginalized groups that have been disproportionately affected by COVID. But in this initial initiative, we are focusing a lot of our efforts because of the disparities that exist in the Black community. But we acknowledge that some of your clients don't only identify as Black, right? They identify as other demographics. And so some of these resources, hopefully, will be beneficial for those who identify not only as Black, but maybe Black Hispanic. Or a particular language that they use. Maybe they're bilingual, maybe they primarily speak Spanish. So when we're thinking about resources that we want to share with our clients, we want to be mindful that these resources speak to who they are. And so hopefully this is a good start to resources that you can provide to your clients that speak to their needs, speak to their identity, and speak to their experiences.
So these, as Dr. Jackson said, these are just some, and all these things take you to much more. And in addition, in the module, there will be a couple of files on monitoring safety, side effects, what is an messenger RNA vaccine. So you see a couple of those things as well. Dr. Jackson, one of the things I was thinking about that you said that I think is really important for everyone to remember is, yes, it is now June 17th, 2021, but it's still a novel virus, and every day we learn more. And every day it changes. And that's one of the things that often both confuses and frustrates people is, sometimes those public health officials have to say to us, we don't know yet. And here's what we're doing to find out. So I think as you even think about, looking at the resources and talking to your clients is recognize that change will happen. And there are some things that scientists and public health people are monitoring closely, like this idea of the variants are different, which are different strains of the virus. So, continue to be aware that the change doesn't mean necessarily that we were wrong. It just means we're learning more as we go.
Exactly. Thank you for saying that, Dr. Quinn.
The other thing that I just, Dr. Jackson's point about listening and being aware that people have questions and respectful. What we've seen with some of our barbarists and stylists themselves, as well as with others, is that for some people, this is a journey. And that journey may take longer for some people than others. And they may start with, there's no way, don't even think about it, I'm not going to do it. And over time, as people around them get vaccinated or people around them get sick, or as they get new information, they may change their mind and they may get to, well, maybe. And, one day they're sitting in your chair and they've moved beyond maybe to, that vaccine clinic you're going to run in your shop next Monday. I want to sign up. It's a journey.
And thank you so much for saying that, Dr. Quinn, because I think sometimes we all kind of forget that, things like vaccinations, immunizations, that's a health behavior, right? And so just like exercising, changing your diet, managing your stress, that's a health behavior, and that's a journey. We don't decide overnight, how to get into certain eating habits, how to start exercising a certain way. We do our research, we ask questions, and then we develop a plan, right? So the same thing would be the case for vaccinations, right? Especially with a lot of these unknowns or even the historical things that we know about it. So we want to honor when people are saying, okay, I need to do a little more research, or I need to ask you some more questions before I make this decision and practice and engage in this health behavior.
And that's absolutely right on. And I think it's, with some of these tools, you have places to tell them, well, if you want to do a little more research, here are some places you can find good information. Because, the beauty of the internet is there's a lot on it. And the beauty of the internet is it's not all accurate or true. But you now have a few tools to use to help them do that.
Yes.
So we just want to thank you for all you do for your clients and your community, and, for being willing to step up and being part of Shots in the Shop, and wish you a lot of success. Yes, you can reach out to members of our team. And, this is my contact information, and this is Dr. Jackson's contact information. We work together, with Dr. Thomas and a number of other folks that you will meet through these modules. So good luck. We're excited about this.
Yes, yes,
Yeah.
yes. And we know that you all are going to do amazing in the work that you you demonstrated that in the work that you have already done. And we know that you're going to continue to do great work for the community in this initiative. So we thank you. Thank you.